Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is Radiation Oncologist and President of Central Care, Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, a second opinion, access to clinical trials and novel treatments, financial counseling, or even other supportive services, maybe for yourself or your family, Central Care is here for you. At any time, feel free to email with questions or comments. The email address is askdoctor@cccancer.com. That's askdoctor@cccancer.com. Our discussion today on Cancer Explained centers around head and neck cancers. So, Doctor, obvious question, what all is included with head and neck cancers? I mean, it's cancers that, I typically don't hear about. As far as it's not as prevalent as, let's say, colorectal, like we talked about last month, or breast cancer, that kind of thing.
Well, actually, thank you very much for having me, Leanne. Actually, it's quite common and more now because of the HPV virus, which we will talk about later. Head and neck cancers or otolaryngological cancers are cancers that basically happen between your eyes all the way down to your clavicles. And so any cancer there is considered a head and neck cancer. And that's a large amount of groupings, which we can go over, but it's all anatomical. The survival is different depending on where it starts, the staging is different, and the way we treat is differently. So it is a topic that is huge and one that has many team members involved in the treatment and curability of these cancers.
So what would be the most common type, I guess, of head and neck cancers? Would it be in your mouth or?
Well, it used to be primarily associated with smoking or chewing tobacco. So you can imagine then the smoking was something that went into your throat. So basically throat cancers would be considered something in your glottis or your vocal cords. Or chewing tobacco in the oral cavity, or basically your tongue, your floor of mouth, the gums, the inside of your lips. Those were the most common ones. And then we have the group that we call unknown primaries, which is where the cancer is very small, the mother tumor, or where this started, and you have a growth in your neck that is a lump or a lymph node that just seems to be growing, and you go to your doctor, they do a biopsy, or they remove the node, and it happens to be a type of cancer you see between basically your eyes and down all the way down your throat into the area of the clavicles, which can start in any part there. And usually these unknown primaries are primarily small cancers in what we call the nasopharynx, or the cancers that can start up behind your nose, or they can be in the oral pharynx, which is like the tonsil, or the base of tongue. These are usually very small cancers that, for reasons that we don't know, have escaped into the lymph node system. So basically you have cancers that are either starting in your oral cavity, meaning your mouth, anything from your lips to your tonsils. Then we have the tonsils in the base of tongue, which is the oral pharynx. And if you go up into the nasopharynx, that's the area that is behind your nose, just before your eyes. You have also the sinuses, which are part of this.
I didn't even think like sinuses, but I guess that's all part of it too, correct?
It is, and the salivary glands as well, which is another kind of different topic altogether, and different histologies. And then you have, of course, thyroid cancer also is included in the head and neck cancers, which is another entity that is treated very differently. Then you have the larynx, which is where you find your voice box, the supraglottic larynx, which is above that. And then you have the hypopharynx below that. And then we have, of course, the oddballs, which are the esophagus that can be in your neck. The esophagus, one thinks of more around the stomach area, but there is a piece of esophagus around your neck. So it is just a gigantic topic.
And so I didn't even think again about your lymph nodes that are in your neck. So, for example, if you do have a cancer in the lymph nodes, that could easily spread into other parts of your body, correct?
Yes, the lymph nodes, as we've done this before, Leanne, I'm going to go over this because it is so important. They are a filtering system. So if you have something that starts, let's say, in your tonsil, it usually directly goes into something called the jugular digastric node. Jugular digastric is describing the area in your neck where this lymph node basically is. Everybody has these nodes, but when they're infected with cancer, they start growing. Jugular because it's around the jugular vein or artery, and then you have the digastric, which is a muscle basically. So it's one that is just below your jaw. And these are typically in the region of the tonsil that would go there. A cancer would go into a small duct called the lymph duct. It would travel to the lymph node and start growing there. And it is a way to fight infection mostly. If you have tonsillitis, for instance, you get these glands in your neck and they are full of bacteria, and your body goes and tells the liver and the bone marrow, hey, we need the crew that fights strep infection. And so the body makes these cells specializing in fighting a strep throat, and they come in and they clean up these bacteria. However, when it comes to cancer, it is made by your own body. It is your own cell. So it has a harder time identify them as invaders. So then it goes to the next lymph node down the chain. Let's say by your muscle, there's a muscle that is one of your strap muscles of your neck, or the sternocleidomastoid muscle technically. And thus they have lymph nodes both in the anterior portion of the muscle and in the posterior portion of the muscle. And it starts going down your neck, and then it can then go into other parts of your body, which includes your mediastinum, which are other lymph nodes. And then it can travel in your bloodstream.
Would there be a common symptom for all these types of cancers for head and neck?
Well, most of the head and neck cancers are not silent. You have a sore. It feels like a cold sore. Or you have a plaque, a white plaque that doesn't go away. And it is usually a premalignant condition called leukoplakia, or the sore can be a very superficial cancer that is due to an irritation, be it tobacco, be it a human papillomavirus, be it a bad denture, and it starts growing and infiltrating the region. So you have pain, but it can also be silent, especially in the sinuses. For instance, you may have sinusitis and you don't pay attention to it. It's just your normal, Kansas weather type of sinusitis, but it turns out to be more than that.
Would it be hard then to distinguish, like, if I got just a sore throat or something, then it might be just a cold, or if you've got swelling or something, then it might be mumps or mono or something? Or?
It is easy to distinguish because these cancers don't go away. In other words, they don't wax and wane. If you have something that gets better with Tylenol or with Advil, it's not cancer. Cancer would not touch it. And so, they're firm. It feels like you have, it could be as firm as a bean or a rock, or it could be as firm, let's say, as a piece of a pork chop. I mean, that type of meaty, density that you feel with meat. And it's not a soft but painful lymph node. It doesn't have to be painful. In fact, the lymph nodes due to cancer are not painful. They just grow, and they're there, and they're firm.
Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo. We've been talking about head and neck cancers, and we covered what makes up head and neck cancers, but now let's dive into causes. So, doctor, what would be the leading cause of head and neck cancers?
Well, it used to be smoking and drinking, and now it is yet also a contributing factor, but we see more HPV positive cancers. And what is HPV? It's a human papillomavirus. It is a virus, and it usually is, there's like 4 types. P16 is one, P18, 31, 33. These are common serotypes of cancers that can cause cancers of the head and neck area. And they are and I'm going to say this because people are always surprised, they are actually venereal, meaning they are caused due to sexual contact. They are cancers that can be spread through sexual intercourse in orally, but it can also be spread through just being exposed to them with your own hand. And these are cancers that usually are involving mucosal surfaces. The mucosa is a covering, the covering of your mouth, could be the covering of your eye, could be the covering of your sinuses, the covering of your esophagus, in between your nail and your finger. Those are coverings. And they attack the basal membrane, and then they start making your cells there grow without being checked. And this is what can be the cancers of due to HPV, which interestingly enough usually have a better outcome with treatment, even when they're more advanced. In fact, these days they come into play in the staging before a stage 4 cancer that was due to lymph nodes and involvement. If it's HPV, can go all the way down to 3 and stage 2, because these cancers are more susceptible to the treatments. So having it be HPV is not necessarily a bad thing. It means actually that the cancer is more curable, but it is the pathology of it, how it got there is different. And these are usually the cancers where you have the contact with the HPV, which is the oral cavity. So where would that be? Usually the tonsils, the base of tongue. Those are the most common. But it can be even your esophagus. In fact, is very common because you swallow your saliva, and once you have these viruses, they can go down your throat, they can go up your throat. I mean, they are what we call a field effect. And every part of your oral cavity or oral pharynx or any part of your head neck area down as it goes down can be susceptible to becoming exposed or inoculated by these viruses. And in my practice, I would say a third, if not a half, of the cancers of the head and neck are due to HPV. But interestingly enough, and this is why, what is the greater number of men to women for HPV is actually 3 to 1.
Is that right?
It is.
I was just going to ask you who is be more susceptible to.
Yes, 3 to 1. And you would say, well, that's interesting. And I have my own theory, and I won't say why, but I think, the why the men versus the women are more susceptible to HPV, I think it has to do with washing your hands.
Men, wash your hands, please.
Really,
Please.
truly, it's just like with the COVID, we are being reminded that we live in a world of viruses and bacteria, and we have to be careful.
So not only alcohol, tobacco products, all tobacco products, vaping, chewing tobacco, that kind of thing could be a cause, but HPV. But what about even occupational exposures to if you're in construction or anything?
There's a lot of carcinogens floating around that can cause it. They are not the most common, but you can have even some of the farmers that deal with the roundups or the different products that have arsenic in it, for instance, can be susceptible to getting cancers because of the irritation or even bad fitting dentures. So
What?
yes, so it is not a cancer can be caused by irritation of some sort. Could it be mechanically? Could it be chemical? Could it be bacterial or viral? Yes. So please, if anybody is hearing me out there, please remember that not taking care of your teeth has lots of consequences. And when it comes to treatment of the head and neck cancers, your teeth become one of the big variables in how you're treated and what needs to be done. So as you probably have been reading in other places, if you don't take care of your teeth, you can get meningitis and other diseases. Heart disease, for instance, you can get from bad teeth. Well, you can certainly count that your teeth not being in good shape will be of huge impact in how you're treated for head and neck cancer.
What about an age? Is there a specific age or all ages could be?
Well, with the HPV, actually, we're seeing younger patients. I've seen one that it was 23, and you see the smoker cancer, the cancers due to smoking, more on the older patient. But it runs the gamut. It's not really a specific. You don't see it in pediatrics. The head and neck cancers in the pediatric world are different histologies.
I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center, and we've been covering head and neck cancers today. And something I know you had mentioned before, but I wanted to touch on again was leukoplakia. I said it right, didn't I?
Yes, leukoplakia.
And it's a precancerous condition, or explain a little bit more about leukoplakia.
Leukoplakia is a precancerous condition that will always turn bad, so it's not something you can ignore. And leuko is a term for white, like leukocytes are the white blood cells. So it's leuko means white, and plakia just means plaque. So you're seeing these plaques. They can be smaller, they can be large, and it looks like if you have very dry skin and you scratch at that white kind of look to your skin, it looks like you have that inside your mouth. And it could be under your tongue, it could be in your gums or your cheek, and it doesn't go away. You can brush it all you want, and it doesn't go away.
And that's something that your dentist, when you do regular checkups, will check for, correct?
Yes, the dentist usually, and here you can kind of gauge the caliber of your dentist, should be checking under your tongue, between your cheeks, because this can hide in places that you are not able to really see unless you had the special mirrors that would show you the back portion of your mouth and between your cheeks and your gums. It's hard places to look at, but you can feel it. Let me tell you, it feels rough. It feels like you have a scratch. It doesn't feel smooth like the rest of your mucosa. There is something there that is rough in its sensation, and that should be taken care of. You should, because actually, if you take care of that, you will not get cancer.
That's what I was going to ask you. So does leukoplakia, if you do have leukoplakia, does it turn into cancer then
It turns
eventually?
into cancer if it's not addressed.
Okay.
And now there are other conditions that can cause you to have precancerous conditions, like what now is being termed as GERD or heartburn or reflux. The reflux can go all the way up to between your eyes. People don't realize that, but you can imagine if you're lying down and you have heartburn because you have a hiatal hernia or whatever reason, this flush of acid up your throat is also not good. And you can actually develop something called Barrett's esophagitis, which is very akin to leukoplakia, all along the area where you're getting this constant irritation by acid, and you can get a cancer.
So definitely do your regular dental appointments too, so they can check for leukoplakia.
Yes.
Nothing,
people kind of want to dismiss even like heartburn as not an important part of management. You're managing your health, and it isn't. Heartburn can cause you a lot of issues, including it can not only burn your esophagus and cause even cancer, but it can also go down your throat and start burning your lungs. You get pneumonias due to this reflux, and taking care of it early on before you have changes that are irreversible is a good idea.
Before you've talked about like what type of cancer cells are with specific cancers, would most of the cancer cells be squamous cells, or
most of them are? With the lining of our mouth and our sinuses are different. The salivary glands are more common in the sinuses or the salivary glands proper, or we have the taste buds, and those are more glands. So the cancers of those areas can be different, but the 90% of the head and neck cancers are the squamous cell, which is the covering that we have in the lining. And squamous means squashed or flat cells. So what happens in these cells is that whether it's a virus or irritation due to smoking, these get dysplastic, we call it, or they become disorderly, they become atypical, and then they start growing and getting and destroying the area and start just basically becoming an infiltrating cancer.
So what kind of treatments are there for head and neck?
Well, there's a lot of choices, and some of them have to do with function. For instance, if you have a stage 1 cancer of your vocal cord, to have it treated with radiation means that you wouldn't lose your voice box. So even though surgery is equally as effective, it's a high price to pay to have no voice. So we treat it with radiation, and it's 90% to 99% effective, with the possibility of doing a laryngectomy or a voice box removal if we needed to make it 100% curable. So we don't burn a bridge. If you're 90% curable with what treatment that leaves you with the voice, well, that's what we'll go. There are some cancers, like for instance of the tonsil, whose spread is not accessible to surgery. Why is that? Is because the lymph nodes that spread into the back of your throat, the retropharyngeal nodes, are not accessible to a surgical procedure, since they're basically in front of your spinal bone. So these cancers are never treated solely with surgery or even surgery alone. So we have to combine the efforts with maybe removal if necessary, and definitely radiation and chemotherapy if there is lymph nodes involved, because we have to treat every part where this can go. It can go locally, meaning the tonsil, regionally, meaning the lymph nodes of the region or of the whole site, and it can be systemic, meaning it can go into the bloodstream. These the lymphatics and the blood supply of the tonsils is very rich, so they tend to spread faster than other places. There are some places, for instance, the base of tongue, or it's a triangle right above your last molar on the bottom, that are very, very difficult to treat because there's not a lot of blood supply in those areas. And so sometimes we have to join all the forces, removal and then treatment with radiation and chemotherapy, because these are highly curable cancers, but their approach is differently, and the side effects, what you're left with to deal with, is, depending on the anatomy. We are made in such a way that the tongue, for instance, has just two sources of blood supply, and they are in the back of your throat. So if you have those two blood supply areas compromised by cancer, let's say of the base of tongue, where you have the nodule in the one side, but it's crossing to the other, the whole tongue has to be removed. There's no way of just taking a piece of it.
Wow. When I think, of course, head and neck cancers, I know that it's all the mouth, inside the mouth, everything, the larynx, and like you said, between the sinuses and behind the nose. But would this ever spread to the brain, since it's right there?
Yes. In fact, the nasopharyngeal cancers, and these are more common in children, are often seen in the brain because it's just a small a quarter of an inch and you're in the brain. But they're highly curable even if they're in the brain. So the location, some people, and this goes also with cancers that spread to the brain. Sometimes people think, oh gosh, this is in the brain, it's no longer curative or no longer possibly to control. And that's the opposite. Actually, the brain may be one of the less difficult organs to control versus the liver. Now, the liver is serious. The brain, you would think that's more serious, but no.
One quick question, too, about even like survival rate. Is it pretty high with head and neck cancers?
Very high, even for stage 4 and stage 3 cancers. That's why I urge people to bear with the treatment. The treatment is harsh. It's one of the harshest because it's a busy area. We swallow, we breathe, we eat. Our saliva is one of the first digestive juices. So it starts basically digesting our own tissue. So it is a very harsh treatment because of the soreness. And again, the field effect. Please remember that if you have a cancer due to a virus, all your mouth, all your tissues were exposed. So it's going to respond to the treatment and it will feel like you're on fire inside. But it's temporary. If you have a curative result, which is most of the cases. In fact, in some cases, I have yet to see one failure, even for a stage 3 and stage 4 cancer in 40 years. But it is a rigorous course. And you need to not give up because you are going to end up with a good result. It may require a gastric tube or we call it a PEG tube or a J tube to sustain you during the treatment, a temporary measure to make sure that you're hydrated and you're eating. But that's a small price to pay for a curative treatment that you will be able to live a normal life once you finish your whole course.
Will it ever come back?
No, when we're talking curative, we're talking curative. And since we address all your lining, it means you start anew. Now, if you're exposing yourself again to cigarettes or HPV, yeah, you can get it again, no doubt about it. And if you let it go too far, it may not be curable. If it starts getting into tissues where it becomes fixed to your bones in your neck or your other parts of your thyroid cartilage and your strap muscles of your neck, or it goes into the bloodstream, that's a more serious situation. And usually the treatment is just so that you can have symptom-free time, because this cancer, if everything was just let go, and I often have this question, what if I don't do anything? Well, unfortunately, this is one of those cancers that can take you for years with a lot of deficit, because your neck is right there. So what happens, you start getting problems breathing, and then you can't breathe. You have to have some kind of stoma. You can't swallow, so you have to have a way of feeding. And then the worst scenario is it goes into your spine and you become quadriplegic. And you don't die. So don't let it go. Highly curable.
Anything else you want to add?
Well, I think the one thing is if somebody if has an issue of the head neck area and you're feeling like you're not getting anywhere because they've done biopsies and nothing has turned out, come and see us, because it could be that one extra pair of eyes that could make the difference in making sure that this is not something that needs to be taken care of.
Thank you so much, Dr. Perez-Tamayo. We appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care, all under one roof, so there's no need to travel far for the best care. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, financial counseling, or even other supportive services for yourself or your family, Central Care Cancer Center is here for you. You have a choice. Bringing expert care to you is an important component in the success of your outcome. Being surrounded by your family and friends, that could be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110, 800-592-5110, or you can visit us online at cccancer.com. You can always send an email, though, too, to askdoctor@cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.